What's up, everybody? It's David. I'm your host of Highway to Health podcast. Thank you for being here. Those that have tuned in, you guys know this podcast is meant to celebrate the people, the organizations that are committed to improving access, experience, and outcomes for our patient community. We get to talk to some amazing guests, and I think you'll learn something from our guests today. We're going to talk about improving not only the access and the experience and the outcomes for a certain patient population, but there's a lot of education that needs to be shared in this space, not only to the patient, but also to the physicians, the cardiologists. And that's why I'm excited, honored really, to have the CEO and founder of Flow Therapy, Michael Gratch. Welcome to Highway to Health.
Thank you. Pleasure to be here, David.
Thank you for being here. First of all, you're an athlete.
Many moons ago, but yeah.
I like talking to athletes.
Yeah.
It's amazing to me how many athletes convert to healthcare in one way or another. Why do you think that is? I've got an idea, but why do you think so many athletes find healthcare as a career and industry that might be interesting?
I don't know. That's a good question. I would assume just when you're kind of elevating your game, so to say, as an athlete, you have to obviously be very in tune with your body and health and fitness, and you kind of get so deep in that process of preparation for that game day.
Yeah.
When the game days end, that preparation doesn't necessarily end. I mean, you've really instilled those habits, as a human, as an individual, that you can really understand and relate to probably better than most things.
Probably more in tune with the healthcare system coming up as an athlete, from all the aches and pains and injuries.
Yes.
So you're exposed to it. I also think athletes aren't scared of hard things, challenges, overcoming certain obstacles, and there's plenty of those in healthcare.
Yes. Yeah, for sure.
I start every podcast the same way. I ask my guests to share a habit, something they've built into their daily routine, helps them improve their mental or their physical well-being. You're a busy guy, but I bet there's something that you make sure you accomplish. Tell us what you've done to stay healthy.
Yeah. So I think kind of the obvious answer is, you want to exercise and have a good diet. When it comes to exercise, for me, it's like I want to have something that I really enjoy, get into. I happen to be in this boxing season right now. So it's a lot of fun just to kind of learn a new discipline, and it's not just kind of getting on a treadmill and hitting the button. But honestly, for me, especially these days in the world of just everything being on a screen.
Yeah.
I make it a daily practice to have a conversation with a friend.
That's good.
Right. I mean, I'm not talking about a meeting, right? I'm talking about like picking up the phone or meeting a friend and just having a conversation.
Yeah.
Because I think that's a real contribution to mental health in a world that everything is head down, tapping on your phone and swiping and left and right. So I think that's a practice that, I think is a good thing. I was talking to one of my best friends from college on the drive over here from Fort Worth, and, it certainly centers me, on something that's really important to me, which is relationships.
Enjoying others is a big part of, I think, our personal well-being. We can get so focused on the immediate, that we're not, or the urgent, and that usually is self-centered. We forget about what's important, and those are friends and family. Mm-hmm. So that's good. That's good. Boxing?
Yeah.
Is that the knee issue? Too much torque? What do you?
Yeah, I don't even know, which is the frustrating part. I mean, I've never hurt myself and not known exactly what happened.
Yeah.
But I had surgery on this thing a long time ago, so I think I just did something to aggravate it.
Old football thing?
Yeah, old football thing.
Flow therapy. All right, that's what we're here to talk about.
Sure.
Oftentimes we get here and we talk about some innovation that's happening in the industry. You guys have been doing this a long time. You've been founded in 2003, so we're over 20 years in.
Yeah.
Tell us about the origin. What is the origin story, and then what got you into it? Maybe what are some misconceptions that are out there in the industry about this kind of therapy and this, the impact it can have on patients?
Sure. Yeah. So Flow Therapy, we provide a non-invasive cardiovascular therapy that we call counterpulsation therapy.
Okay.
EECP therapy is what is kind of known for, the acronym and more the medical community, but counterpulsation is the mechanism of which the therapy operates. So the origin of the company is really something that I hold very dear to me. It's a mission-led organization. As you mentioned, over 20 years ago, my grandfather actually was our very first patient.
Really?
And so, it's kind of one of these stories where he was kind of that classic cardiovascular patient that had multiple bypasses, multiple stents. He still had symptoms and was just kind of, told to kind of go settle down and, and kind of limit his activities. He was my guy. I mean, we all have like that one family member in the tree that you're really close to. And my granddad was certainly that individual for me. And I was getting out of college. I got an opportunity to go play some professional football, which I was really excited about and very passionate about going to the next level. And really kind of for no other reason, just looking for an option to fix a problem for someone I loved, came across this modality that was, somewhat prevalent in the academic kind of arena, right? I mean, this therapy, EECP, it was at Mayo, it was at Duke and Harvard and Cleveland. And so when I came across this really just as an option and literally just Googled this, you kind of go down this rabbit hole of, understanding the sciences. I was raised around people in the healthcare industry. So some of that stuff is a little bit intrinsic when you're raised around anything. So I knew enough to be dangerous when it came to understanding, hemodynamics and, man, this makes sense. And wow, these big institutions offer this. And, oh, wait, this is covered by Medicare. And then went and actually traveled to some of these places and visited with the physicians and the technicians that were delivering the service, spoke to patients. And it was like, wow, these patients, they get a lot better. This is something that's completely non-invasive. And really what dawned on me was the simple thought of, hey, it's clear to me this delivery model is broken. Like this therapy just doesn't belong kind of in a hospital setting for certain attributes about the treatment. And so it kind of came down to literally a single day where like the agent called, said, hey, you got offered an opportunity to go play ball in Canada. It was the CFL, or is the CFL. And it was a fork in the road. I mean, there was a decision point on saying, hey, do I go do this? I had this somewhat calling that it just seemed clear and obvious to me that if I think as more of an entrepreneurial mindset, like I could build a better box that could help my granddad. And there's probably a lot of people like my granddad that could benefit. And that gave rise to starting the company 20 years ago.
What a story. Talk about a mission-led, heart-led, thing that you went on. So your granddad went through the therapy?
Yeah. He had an amazing outcome. He was 80 years old when I started the organization. 2 quadruple bypass, 3 stents. He lived to be 95 years old, which I believe, we looked this up, he missed like the Guinness Book of World Records as the longest survivor post-quad bypass by 1 year.
Wow.
Okay. So he greatly benefited. And I'm sure we'll get into this on how the therapy works, but he was someone that just, his shortness of breath went away. He had a lot more active years.
Case study.
Yeah. Look, and we got thousands and thousands and thousands of them now under our belt. So that's just kind of, it's always interesting to have conversations like this and look back every once in a while. And it's kind of interesting because that was many moons ago, but he had a great outcome, and it represents the thousands and thousands of patients that we've touched, to date.
What, for the physician or the patient community out there, like we're going to get more into this, but, especially for the patient community, if this is their first time hearing about EECP and flow therapy, what should they be considering? What should they know, but also be aware of in their own personal or their loved ones' care journey that should say, hey, maybe I should look more into this?
Yeah. I think, where this sits today is patients or individuals that have, a diagnosis of heart disease, that they have exertional symptoms. So symptoms when upon activity, such as whether it's chest pain or shortness of breath or fatigue, and those, they come on with activity and then they resolve at rest.
Yeah.
And there's not a clear option for an invasive procedure. Counterpulsation therapy probably is going to benefit them, and it's covered, and it's a covered service. And I say that
that's a huge piece.
It's a huge piece, but I mean, coverage just doesn't happen. It
Right.
happens because there is a litany of randomized control trials in peer-reviewed published papers. There's over 500 of them on counterpulsation therapy that really proves the safety and the efficacy of the modality. It's something that our mission is to make this accessible to every person that can benefit from this therapy in the country. And that's the march we're on building a platform to do that. And when we do that, and along that journey, it will be recognized. I think the term that we use is called standard of care,
Mm-hmm.
right? And we're working towards that, and we're getting closer and closer to that with some of the, the things that we've kind of broken through in the past couple of years, which is exciting. But if you're a patient, the things to know is this is proven, it's safe, it's effective, and it's out there if you're someone that has these types of heart symptoms.
And there's no shortage of patients that fit that model. Something that I pulled this morning, over 1 million patients in the U.S. annually, with about 50,000, 60,000 getting care annually today. So there's a huge gap in whether it's understanding or accessibility to this therapy. There's a whole community of patients out there that could benefit. That gap needs to be filled. They need to be aware of it, and they need to have access to it.
100%, and the number's probably even a lot bigger than that. I think you're kind of putting a box around a term that is refractory angina, and
Yep.
I think one of the biggest misperception, I think, from the physician community is that when this therapy came about, it was kind of put and labeled as last line. Okay, so it's this: when all else fails, then let's go do counterpulsation or EECP.
Yeah.
The main reason for the position of that in this pathway is the delivery model, the broken delivery model. It was very difficult to get to. Patients would have to maybe go to an academic institution. It's delivered over a 7-week protocol. But if this was a pill, okay, or if this was something that was easily accessible, it's completely non-invasive, it has great outcomes, therefore it should be accessed before last line.
Sure.
Right? I mean, that just is, it makes sense. It's intuitive.
Any other therapy that you just described, wouldn't be saved for the last line.
Exactly. Why would we save the Hail Mary when something is so safe with all this upside?
Yep.
So it speaks to this gap, this opportunity, which really is a delivery model. So if we have a delivery model that patients can access in their communities, that I don't hesitate and say is enjoyable, okay, then it unhinges this therapy from this caboose of the pathway and allows it to float and sit where it should. And in our humble opinion, it's a part of medical therapy. It is a part of the decision-making process of within medications, within procedures that are absolutely appropriate, and stents work and stents are great. But sometimes we don't need to do all these procedures when you have an option that has virtually no risk with proven outcomes. And then, at the end of the day, that should be a part of the decision with the patient.
Right.
And right now, both sides, the physician community, the patient community, and the payer community, there's an opportunity to get more informed on where counterpulsation fits kind of in that ecosystem.
This is why I like having these conversations, because there are, like, from the patient side of things, we will delay treatment, delay care that seems scary or expensive. And invasive procedures are that to a lot of people. They're also inconvenient. There's downtime in work. There's downtime in a lot of things. And so oftentimes a patient can delay the care that they need because of those factors. Not only does this provide improved outcomes, and that success is proven over the last 20 years or more, it also offers a less invasive, less scary option that might get the patient the treatment that they need sooner, which is a huge key to the outcomes being improved. You talked about the difference in the delivery model and how that will improve accessibility. Talk more about that. What was the delivery model that you witnessed and experienced with your grandfather contrasted with the delivery model that is available now through flow therapy in 2026?
Sure. Yeah. The historical delivery of ECP, really, I would describe it as either kind of in the belly of a hospital campus. So you have, again, I just want to start by saying when patients receive this therapy, they come to an outpatient location to receive this therapy
now,
1 hour a day, 5 days a week
Okay.
for 7 weeks.
Okay.
Right. So you have to kind of bolt around.
Gotcha.
There's this 35 unit protocol.
Right.
Right. So historically, coming and receiving that therapy would be going to a hospital campus. You have a parking garage that you have to negotiate. Sure. You have floors in a hospital campus, or it would be in a large, cardiovascular group office that we would say, kind of the creepy room at the end of the hall.
Gotcha.
Right.
Gotcha.
Where it has a unit in a small room. Flow therapy is a center of excellence model, right? So our entire facility is designed around the delivery of this therapy. So, I'm not a big fan of saying spa-like feel, but it feels very nice when you walk in. We are very meticulous about the design, the lighting. Every patient has their own, treatment suite. We have technicians, we have nurse practitioners that are specifically designed and trained to walk with the patient along this journey. And it's easy. You come in, there's not going to be wait times. You're going to have content, whether it's educational material for their healthcare, or they're going to watch Netflix and watch an hour of the movie, and they're going to knock it out the next day and finish it. So just the access, the experience is completely different than kind of that room at the end of the hall.
Like anything, when you're specialized in it, you can improve it. And you guys are specialized in a space where previously it was one of many things that a provider had to deliver in whatever four walls they were operating in.
Yeah, and it wasn't their focus, right? I mean, it goes from kind of being the ninth thing on the menu to being the only thing on the menu. So having dedicated staff where, we kind of obsess about this therapy and all the details to it. It makes it completely different. And then also we have, in certain communities that we serve, we have locations that are very accessible, for the patient to be able to get in, get your hour of therapy, you get out, you go to work, you go about your business. There's no recovery time. Yeah.
Everybody, the perception in healthcare is if I have a doctor's appointment, that's my day. I don't, and again, that prevents us from getting the care that we need because we oftentimes see it as too big of an inconvenience to go.
A way that we think about this, because I think that this is an important point. We all know that we should exercise.
Right.
Like ideally we exercise every day at some point, right? The patients that benefit from flow therapy, they're in a position where they can't exercise. They have symptoms. Right. If they do so. So if you were to kind of put a rope around the time that if they didn't have these symptoms, that they would go and invest in exercising, for that hour a day, right? And instead, they thought about that as coming to flow therapy for their exercise.
There you go.
Then it makes complete sense. It creates a habit, which is a very beneficial habit, because I'm sure we'll get into on actually what the therapy is and how it works.
Yep.
What we're really doing to the body is passive exercise. So they can kind of think about it as, going to rehabilitation, going to a gym, getting their hour session, and then, like you said, going about their day to accomplish whatever they want to do.
We talked about this being around for 2003, flow therapy was founded. The therapy was, EECP was around before then. It seems like a long time, but we know in healthcare, like, time flies like this. And I'm thinking about the cardiologist that probably needs to refer this patient to this type of therapy. What do they need to understand more? I mean, what delivery model needs to change in the education that they need so that this becomes more of an upstream solution, route, care journey, as opposed to it being this Hail Mary at the end?
Yeah. I mean, I think education is the likely answer to that. And I think that if I could instill with confidence, one thing is them recognizing that this is it's a management tool, right? It's part of optimal medical therapy for these patients that have chronic ischemic disease, right? I mean,
it goes back to your standard of care comment. This needs to be a piece of the optimal standard of care for these patients.
Right. If you go through the process of how we learn something, and I honestly have never seen a situation where the physician would come to one of our programs, a dinner event, a lunch event, and really sit in the data, that they don't come away going, like I didn't realize the data was this good.
Sure.
Right. Especially something that is so safe. Right. I mean, that's the oath, right? That physicians have, do no harm. Right. So when you're balancing all day long risk benefit, right? And that's the balance all day long with clinicians, right? Risk benefit to my patient.
Oh yeah.
Something that has virtually no risk and only benefit, right? For a disease state that it's proven to impact. Like, that's a great situation.
Yeah.
Right. And I think the non-clinical aspects get into the clinician's mind a little bit too much. Like, my patient won't drive 7 weeks.
Yeah.
It's too far. Oh, hey, they work, so therefore they can't do it.
More adherence than
the
or
therapy just non-clinical challenges, right?
Yeah.
That we're built to solve that. I mean, when you look at our data, it's something like 50% of patients in our Charlotte office in 1 year traveled over 20 miles each way. It's like, well, that's interesting. Patients will drive. 30% of our patients or something like that are gainfully employed. Okay, so they can do it with their job. Like, we have hours and we have solutions to work with that. So I think it's those things that let's not create a barrier that we have a solution for. If the patient can benefit from improved circulation, improved blood flow, improved endothelial health, then you can check this box and let us partner with you to see if we can get the patient in and get him feeling better.
Yeah. I don't want to put you on the spot. You don't have to answer this if you don't want to. Are there other motives as to, like, to direct a patient towards a different type of therapy? Like, we're seeing, I feel terrible asking this, but it's part of the conversation nationally right now. You said it was covered by Medicare, which means there's reimbursement there. Is there a financial reason why they would stay away from or choose an alternative
Physicians?
Therapy? Yeah. Cardiologists, physicians.
No, I don't think that at all. I think at the end of the day, we're all creatures of habit. I think at the end of the day, everybody's very busy. And I think it's more of when physicians get in a rhythm of their day and they're seeing 25, 30 patients a day, everybody, you follow an algorithm.
Mm-hmm.
And I think one of our challenges as an organization is just really breaking into that algorithm.
Gotcha.
And where it goes. And we have a lot of physicians that were fully in the algorithm. And we have physicians that use us every single week. And they love the patient outcomes. But I think it's about kind of what I was saying before is let's not make it more challenging than it has to be.
Sure.
Right? You're not going to get stuck in this 15-minute conversation with a patient asking you a bunch of questions that you just don't know the answers to. Like, that's what we're here for.
Yeah.
So we feel like we have a process to reduce that friction, make it easy. But our therapy doesn't really trade off anything that they are, using your term, kind of maybe economically motivated to do. Like, this is something that is positioned after invasive procedures that, look, if you got a lesion that you can go and stent, like our position is go stent it, right? If that's what's causing if that's the right thing to do. We're not competitive
Sure.
to interventional cardiology whatsoever. We're a complement. But the data shows when a patient has a perfect stent, a perfect stent, still up to 25% of those patients are going to have angina within 1 year. Okay, that's the data in the highest impact journal there is in the land, right?
What percentage?
Up to 25%.
Wow, on a perfect stent.
On a perfect stent. So what does that say? It doesn't say that it doesn't have anything to do with the operator.
Right.
It has to do with the systemic nature of the disease.
Okay.
Right. It's not logical to think if you have heart disease, it's relegated to a single pipe.
Right.
Right, to that vessel, that stent. Like, it's a systemic issue. It's heart disease. So the culprit could be microvascular. It could be something in another, and something else that we just don't know.
Yeah.
And so what flow therapy is a little bit of that shotgun to complement the sniper rifle, for lack of. It's probably not the best analogy to put on the record, but
for me it is.
Yeah.
It makes perfect sense for a guy like me.
Yeah.
So what's the session look like if a patient is trying to picture or visualize the experience? Tell us about that. What would they expect?
Yeah. So when a patient comes in for flow therapy, as I mentioned, they're going to come into our outpatient facility. They're going to get, they'll get changed in some kind of going back to the athletic part. It's almost like a cotton version of a running tight.
Yeah.
So it's a real kind of tight formed kind of pant around their legs, and they get on a piece of technology. So this technology is a padded treatment table where this pneumatic cuff system, so it's blood pressure like cuffs that go around the calves, the thighs, and then the lower hip area. So it almost kind of looks like a pilot G suit. Okay. So next,
Sweet.
Yeah, it is. So next, they'll have a 3-lead EKG on, which that measures your heart rhythm, which really is just a triggering mechanism for the technology.
Okay.
So when the heart goes into this resting phase, these cuffs will inflate at a pressure, like calves, thighs, hips, all at that half beat, right, to push blood flow back to the heart while it's filling.
Okay.
And then on the onset of the contraction phase of the heart, these cuffs suction deflate, so it unloads the heart when it's beating. So it's kind of like opening the back door of the home when the front door is open. It like pulls all that blood flow out of that chamber that is looking to, feed the rest of the body. So you're literally counter pulsating with your heart that's pushing blood flow back to the heart when it's accepting, and pulling it out when we want to eject it. And that rhythm, does a bunch of wonderful things besides developing these little routes around blockages called collaterals. So symptoms of heart disease is really just a manifestation of imbalanced supply and demand.
Sure.
Right. So if you can restore that, you're not going to have symptoms. So we restore that by augmenting existing vessels and actually turning the levers on to actually develop new little capillaries called collaterals around problem areas to get blood from A to B and restore that. And there's a beneficial inflammation cascade, a lot of great things that is that kind of passive exercise of your cardiovascular system that results in a clinical benefit. So these patients are going to lay on this padded treatment table. They got noise canceling headphones on. They're watching a movie or listening to music, and they're being squeezed. It's like a deep massage to the rhythm of their heart. Right. So when I get on the bed, right, and it's kind of this real neat biofeedback experience, right? I have my resting heart rate's probably, 60, right? And when I get on the bed, it comes down to like 52, right? Because you really relax into the rhythm of that good squeeze, all right? And that's an hour that you're going to kind of chill out. You're going to watch a movie, or you're going to have some good thoughts. And then, the bell goes off, technicians take you off and you go about your day.
And then afterwards, recovery phase, I mean, they walk out of there ready to go back to their daily routine. It's not like they have to go take a nap. There's no recovery phase afterwards.
No.
This technology has been around. You've been around 20 years. How long has the technology in general been around?
So the first concept of external counterpulsation, I mean, it was back in the early 60s. So there's things in cardiology today that's used every day. Like one's called the intra-aortic balloon pump.
Okay,
the IABP, that actually derived from the first external counterpulsation device.
Okay.
So, yeah, I mean, the idea of this externally counterpulsating has been around for a minute. It actually originally was used for cardiogenic shock, which is a really, really like you're on death's door kind of thing. It's the idea of like, let's get blood back to the heart, like as quickly as we can. So the concept has been around, but yeah, it's really kind of been this evolution of cardiology. I mean, when I first got into this, as you mentioned, 20 years ago, it was kind of the height of what's called drug-eluting stents.
Yeah.
And everyone, we all believed with all the right reasons that this was going to be the panacea for heart disease. And the data, over 2 decades, it just showed otherwise. Like it's great for symptom relief, but it just didn't. So there's just been this movement, right, in the entire environment of cardiology, into, how do we better, manage these patients? Like there is a therapeutic gap because diagnostics have gotten so good that we can see things that we just couldn't see 10 years ago.
That's true.
Right. So it gives rise for an opportunity to do something about it. And therapy is a part of that.
Yeah. The amount of data that has to be there to prove all of these things over the course of 50, 60 years is incredible. So if a patient wants to go do a deep dive, they're going to find all the stuff that you already know, that you're already telling them. So the trust, the credibility, the process has been proven. Tell us about access. Is this just a Dallas thing? You mentioned Charlotte. Tell us if patients are looking for areas of access. Tell us about, where they could find more information or where they could find access.
Yeah. So our platform right now at Flow, we're in several markets in Texas, as I mentioned, in Dallas, Fort Worth, and Austin, and San Antonio, and we're in Charlotte. We're real excited about kind of a next chapter for us as an organization through partnering with health systems.
Yeah.
So we're partnering with a top tier health system outside of Atlanta called Northeast Georgia Health System, NGHS, and we are in construction right now for our facility out in Gainesville, which is just outside of Atlanta. So we're going to put a couple of locations out there, and we're talking to some other really big systems right now about using that model to joint venture with them to gain access and integration into their care model, which is really exciting.
Smart.
But yeah, patients can obviously find information about us on our website, which is just flowtherapy.com. We have a wonderful staff, that knows all the data. If you're in the physician community, please reach out to us. Our director of medical affairs, Dr. Jesse Fox, is remarkable and has just complete command control over the hundreds and hundreds of peer-reviewed published papers. So she's a big part of that mission of driving education through the data. I think it's interesting, because you brought up a couple times about being around for 20 years. And it's like, when I hear that, I'm like, man, 20 years is a long time. But it's really kind of been almost 3 different companies.
Oh yeah.
Right along that journey. Right. When I started this, I was out of college. Hey, do I go play football or help my granddad? And I enjoy ramen noodles, so it's no big deal if this thing works or not. And can you kind of get an ember? Does this thing go?
Yeah.
And then there's kind of this transitional period of, hey, could I repeat this? Cardiology changing, and then obviously we had the pandemic, and now it's like we're kind of getting into a little bit of the major leagues, into cardiology. We've grown up as an organization. We've learned a lot. We feel like we have some real I don't know, secret sauce elements to the way that we deliver this therapy that's becoming more relevant today than it's ever been since the technology was ever introduced.
Is that because of population, or what do you mean more relevant?
Yeah, I think that when you look at drivers in the healthcare, we were talking off camera about, how, insurance works and some of them being a key stakeholder, and insurance companies are built to make and save money.
Yep.
Right. And to reduce cost. So the result of this therapy, when patients use it, they go to the hospital less. Right. If you have heart failure and you're managing heart failure and you qualify for flow therapy because of ischemic symptoms, we've published great data that shows that there's an 82% relative risk reduction in readmissions to a hospital.
Okay, which is such a cost driver.
It's huge. That is such a big line item that if you use this, you mitigate this cost. And what patient doesn't want to mitigate a hospitalization?
Right.
I mean, that's a huge motivator to not end up back in the hospital. Instead, come hang out and, get this great non-invasive service. So value-based healthcare, population health, those things are relatively new.
Yeah.
Those things weren't around, when we started this organization.
Yep.
So I think, that's an example of how I think we fit into that ecosystem, more so now and into the future than ever before.
That's a great point. Avoiding readmission, improving quality of care, value-based care. It all is an effort to control costs for the provider in the system. This is a great way to do it, especially if it's covered already. So, last question I have for you. I guess I have two. We talked about how physicians can learn more and gain access, get involved. How can cardiologists get more involved?
How can cardiologists get more involved?
Yeah. How would you invite them into this community, into this ecosystem, for those that aren't a part of it already?
Sure. Well, I think the biggest tool for us accomplishing our mission is education.
Yeah.
Right. I think it's education, and I think education begets utilization. Utilization begets, for lack of a better term, a movement. Right, where this is now something that's kind of in the toolkit at standard of care. So as the cardiology community continues to learn about this, like we love having cardiologists educate other cardiologists.
There you go.
Right. I mean, there's nothing better than, the gold standard of peer-to-peer.
Yep.
Right. So I would invite any cardiologist to come and learn more about the data if they're curious. I would invite any cardiologist to use this in their practice of medicine for appropriate patients. And I'm highly confident they're going to have a remarkable outcome with their patients. And then I would further invite cardiologists to help educate other cardiologists about it, because it only benefits the patients. And that's what this is all about.
Somebody listening to this, if they remember one thing only, like, what's the takeaway that you want to stick in the minds of the listeners, the watchers, the viewers?
Yeah, I think if it's from the point of view of the patient, or someone that's caring for patients, a family member, I think it's really probably blood flow matters. Healthy circulation matters when it comes to that pathway of fighting the number one thing that's taking us down as Americans, is heart disease. And just knowing that there's an option out there that's non-invasive and it's effective, and we're here to help in any way.
There's so much momentum around, helping the body heal itself. This fits right into that message. Appreciate you being here. Congratulations. What a ride, man. You said, 20 years, 3 different companies. That's how it feels. I bet it's been very, obviously daunting of a task, but also really rewarding. And it happened almost immediately with your grandfather. How cool. I bet that relationship only got better.
Yeah. It was very special.
I bet. For those listening, what you're hearing is a purpose-built delivery model for a proven therapy. And whether it's you listening, or a loved one listening, a family member listening, a friend, it pays to learn about the different options, therapies that are out there. And so bring this up with your cardiologist. Do your own research. Access is improving. Experience is improving. And that leads to improved outcomes. Thank you for being here. Thanks for teaching us about some of the things happening at Flow Therapy. And good luck to you.
Thanks, David. It was a pleasure to be here.